Okay, so please, rest of community, please chip in if I don't represent what you were saying correctly. So we started talking about the enablers, which we thought was good because we didn't go straight to the barriers. So we started off trying to be positive. So we thought what was good was the continuity of investment and learning, so it's symbiotic. So, we felt that there is a need for us to invest in our future workforce, I suppose, and to continue developing them. And we thought that was a great opportunity to do that. When the students come to Oriel and look into where they're going to do their training year, their foundation year, and it'll give them that experience, because what we do find is often we'll get trainee pharmacists, graduates coming to us, and they've not had any experience at all in a community pharmacy setting or even a pharmacy setting cross sector, I think, as well. We felt that the confidence will increase across both parties. So hopefully by them getting a lot of hands-on experience, that will increase the confidence of the students, but it'll also give us more confidence as community pharmacists, as the students and the people that are coming out of universities as well for the future. Great to support the university as well, so sort of mutual, we'll be working alongside the university, supporting students within our localities. So we thought that was an enabler. And then also using a formal assessment structure. So we thought that was really important, but it was also beneficial because we'd be getting sort of hopefully quality paid placements across multiple places. We like the Miller's Triangle and how we'll be supporting students to get to the top of that and allowing the students to actually do. And we felt that really embeds the learning. So once they've learnt and then they can come and put that into practice, that really helps the learning sort of sink in, I think. And then there was a benefit as well. So we were presuming that the tutors for the students, when they come out, wouldn't necessarily have to be 3 years qualified like they need to be a designated supervisor for a trainee pharmacist. So again, we thought that would be an enabler to grow some of our younger pharmacists and give them opportunities to mentor, coach students, which will then enable or improve, help them to go on that journey to actually being a designated supervisor in the future, when they perhaps have been qualified 3 years. And also it'll give people the opportunity to be clinical supervisors, maybe go on to be educational supervisors for newly qualified programmes and the like. So then barriers. So it was the level of autonomy. So what we're talking about there is, what is it they'll be able to do? So we felt we needed some clarification. Would they be able to get involved in sort of services that we offer in community pharmacy? And I suppose that brings it in quite nicely into indemnity as well. So what will the indemnity be when we've got these students in the pharmacies? The level of supervision, how much time would that take away from our pharmacists? I suppose, does it need to be a pharmacist that does it? Could we use a pharmacy technician? Could we use a trainee pharmacist to do that? So just a bit more understanding about that role and how much time that would take, which then probably brought us on to the funding. So we felt that the funding was quite low, so £25 a day isn't a great deal if they're taking up quite a lot of that pharmacist's time. And then we talked about, does that then devalue the actual profession of a pharmacist as well, with the money that they're getting paid to sort of do that? I suppose we sort of rolled from one thing to another quite nicely. There are quite a lot of workforce issues in community pharmacy. So it's about how do we get that consistency of a tutor for the students as they go through sort of their training and their placements with us. Increased workload, so probably everybody knows, quite a few community pharmacies are closing down, so that puts more pressure on the ones that are still there. And we're also being asked to deliver more and more services on behalf of the NHS, which is great opportunities, but then it puts more pressure on those people that might be expected to be tutors for the placement students. And then one last one was as well, physical space. Some of our community pharmacies are really small, so how do we fit an extra body in there as well? So it's just sort of thinking around, that could potentially become an issue. So it might be, again, when you probably come out and accredit stores for placements, something